Hello, my name is Gary Wheeler, and I am a nursing student at Indiana State University in the Community Health Nursing 444 course. This video is a health education project on caregiver burnout. By the end of this video, it is my goal that the participants will be able to identify what is caregiver burnout, predict caregiver burnout, and develop a plan to reduce caregiver burnout. At this time, please pause the video and take the accompanying pre-test. So what is caregiver burnout? According to the Cleveland Clinic, caregiver burnout is a state of physical, emotional, and mental exhaustion that can accompany caregivers who do not get the help they need or are not able to meet the demands physically or financially that caregiving places on them. So now that we've defined what caregiver burnout is, I feel that it is important to define what a caregiver is. According to Webster's Dictionary, a caregiver is defined as a family member or paid helper who regularly looks after a child or a sick, elderly, or disabled person. So now that we've defined what a caregiver is, let's talk about the types of family caregivers we may run across in healthcare. One example are family members that may be taking care of patients that are living with a form of dementia, such as Alzheimer's. Another type of family caregivers that we might run across in healthcare are family members who are taking care of patients that are staying in a medical facility, such as a hospital, a skilled nursing rehab center, or a long-term care facility. And finally, a type of family caregiver that you also may run across are family members who are caregiving for patients that have a chronic illness. So now that we have a better understanding of what a caregiver is and what caregiver burnout is, I would like to focus primarily on family caregivers of patients diagnosed with dementia, and more specifically Alzheimer's, and how caregiver burnout can affect this population. Since we're going to be covering family members that are going to be caregivers for Alzheimer's, let's learn a little bit more about Alzheimer's. According to the Alzheimer's Association, right now in 2019, 5.8 million Americans have been diagnosed with Alzheimer's, and that number is projected to be 14 million by the year 2050. In fact, 1 in 3 seniors will be diagnosed with Alzheimer's or another form of dementia. And Alzheimer's right now is responsible for $290 billion in healthcare costs, and that number is projected to increase to $1.1 trillion by the year 2050. With such astounding financial ramifications coming from one diagnosis, it's no wonder that family caregivers are being relied on more and more. In fact, right now, more than 16 million non-paid caregivers are currently taking care of Alzheimer's patients. These non-paid caregivers are often family members that are providing care, and they will provide approximately 18.5 billion hours of care in 2019, which equates to around $234 billion in care this year for Alzheimer's patients. Every nurse at some point in their career is going to deal with caregiver burnout, whether it's through staff or through family members. So specifically with the family member caregiver burnout, how can we as nurses help? Luckily, caregiver burnout has been researched enough, and the significance towards the health and well-being of the caregiver is understood. Because of that, there are many resources that are available to these caregivers. Programs such as care breaks exist, which assist the family caregiver in scheduling and financing temporary, often home health caregivers that will come in and provide that family member a short break from their caregiver duties so they can provide their own needs. The Department of Elderly Affairs also puts out a bunch of resources, including the Guide for Caregivers, that offers tips and resources that they will specify by the age and the diagnosis of the patient that the family caregiver is caring for. Many states have resources available as well. For example, Rhode Island has an available curriculum that will actually teach the family caregiver how to effectively communicate their needs as a caregiver, and will actually meet weekly in group sessions for 2.5 hours with those caregivers. And finally, the Alzheimer's Association itself will provide a wealth of resources, including a free 24-hour helpline that offers free caregiving tips, respite care options that gives the family caregivers breaks, and information on available resources for the patient. I hope this video presentation of family caregiver burnout has given you the tools to identify that caregiver burnout, how to predict who is more predisposed to getting that burnout, and finally how to reduce that burnout once you've identified that caregiver suffering from caregiver burnout.